So there's another concept known as the walking pneumonia syndrome. And this walking pneumonia syndrome, probably most of you guys would have heard that the name is also atypical pneumonia. So basically, in the typical type of pneumonia, you have this pneumonia caused by the Streptococcus pneumoniae, and the symptoms are just like that, like that, like that. All right. In the normal type of pneumonia, just know that that one is a normal. So when we are talking about atypical, first of all, the microorganism causing this is what? A different type of microorganism. This is a Mycoplasmal Pneumonia. Do you understand? So you have it not presenting with the classical signs of pneumonia. That's why they call it an atypical pneumonia, or some people call it a walking pneumonia syndrome. So it's more of like somebody has pneumonia, but they are very okay walking about doing their normal day-to-day activities. Do you understand? So let's have it. Let's define this. We'll define it, talk about the characteristics, talk about the symptoms, then diagnosis, treatment, and complications, prevention, and differentials. Okay. So for the definition, we are saying that the walking pneumonia syndrome is also known as atypical pneumonia or mycoplasmal pneumonia. It's a mild to moderate respiratory infection disease. It is caused by the Mycoplasma pneumonia bacteria. Okay. It's insidious on onset, often resembling just a cold. Alright. The person will just be as if they are just having a cold or something. It has mild symptoms. That's why we're saying what? And you see, allows the patient to continue doing their daily activities. That's why they say walking pneumonia. You have pneumonia, but you're walking about as if you are not sick. Do you understand? It typically affects children and young adults. What are the symptoms? Everything you see in walking pneumonia is mild. Alright? Every symptom you see in walking pneumonia will be mild. So mild cough, low-grade fever, mild headache, mild fatigue, sore throat, runny nose, muscle aches, chest tightness or discomfort. But everything is just mild, 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 mild. Do you understand? Then diagnosis. How can you be able to confirm that you have a walking pneumonia syndrome? Yeah, basically you do a physical examination of the patient, do chest x-rays, blood test, sputum gram stain culture, PCR or serology test for mycoplasma pneumonia, right? Treatment, you still employ those antibiotics, advise the patient to rest, you rehydrate them, that's resuscitate. Then over-the-counter pain relievers, then cough suppressants too should be employed. Complications. Even as this thing is mild, if you leave it there without proper care, it will now progress to something serious, right? So it could lead to respiratory failure, bronchitis, pneumonia exacerbation, alright? Could lead to ear infections, lead to neurological complications, right? The prevention, yeah, always get your vaccination, always practice good hygiene, then avoid contact with anybody that you know that has pneumonia. Also avoid going to places that you have seen that they announce that there's pneumonia outbreak, or if you have pneumonia, you can help us by trying to um, isolate yourself, right? So that's just the right thing to do. So looking at this, these are the differentials for walking pneumonia syndrome. All right. So if it is not walking pneumonia syndrome, it could be this. All right. So guys, looking at this, that's all about walking pneumonia syndrome, also known as atypical pneumonia or mycoplasma pneumonia.